medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic health care. Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital, Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, MCH and maternity, ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cash.
Specialist clinics and CT scan services. Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 0797 972 794 or 0769 781 880 or 0717 305 204 or email us at info@stmarysmissionhospital.co.ke. St. Mary's Mission Hospital, Langata. Compassionate in healthcare. Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
To dear viewer for joy, and thank you very much for joining us on our Health Corner show right here on Capuchin TV with me, Maureen Kimani, for another episode. And I'm so delighted to have this conversation. And as you can see down below on the screen, that our conversation today is all about oral health and dental care. And just to remind you that in our Health Corner show, this is a go-to space where we have conversation and things that concerns your wellness, and of course we shall be learning a lot on this. And this program is brought to you by Capuchin TV in partnership with St. Mary's Mission Hospital. And of course, you know, we shall have and we have a representative from St. Mary's Mission Hospital, and she will be introducing herself in just a few. And just to say, as we dive into this conversation, I know when you start your morning, the first thing that comes to your mind is to go to your bathroom and brush your teeth. But how do you do it? How many times do you also do it? And how many times have you changed your toothbrush in ile to the one that you're using since January is the one that you still use December? We shall be talking all that conversation. And please do tell us in case you'd love to be part of this conversation. Do not hesitate to reach out to us on 0717-424-866, or you can use the SMS number that is 21760, telling us on how you brush your teeth in the morning and how do you keep your oral hygiene going, just to make sure your smile is bright. And allow me right now to introduce my guest to you here with me. A very good morning and hello. You look beautiful.
Thank you, girl. You look beautiful too.
Oh, thank you.
I'm happy to be here. My name is Rose Kinya, her community oral health officer. So today we are going to talk about oral health and dental care. Sometimes people assume that oral health is about brushing, but that's not enough. We are going to go deeper on how to take care of our teeth, yeah, so that we can have a better smile like her. You see that smile?
Thank you.
Oh, it's beautiful. Yeah.
Thanks.
Yeah.
And I can see you came well prepared. You have very many props of which you shall be telling us more about as we continue with our discussion today. And thank you so much for making time.
Thank you very. I'm happy to be here. The first time on TV.
Oh, wow.
I'm so happy.
You're so happy.
Yeah.
I can totally tell that.
Yeah.
And well, as I mentioned that when we talk about oral health and dental care, not so many people just tend to pay attention to this kind of discussion, and they might be asking, why do we want to have this kind of discussion here at Capuchin TV? Why is it even important to, you know, take care of your oral hygiene? Please tell us more about that.
So first, let's know what is oral health. Oral health is the care of our teeth, mouth, the muscles, the bones. It's not only about teeth. We have the ribs, the cheek, the tongue. People don't concentrate on the oral cavity. They only concentrate on teeth. So oral health is all about everything in the mouth, the cheeks, the tongue, how to brush your tongue. Yeah.
And why is it so important to have that attention and give that attention to oral health?
Oral health helps us in smiling, talking, eating. So when you don't have a good health, how will you eat? How will you smile? Like now you are smiling. Yeah, speaking, self-confidence. You get, also the mouth is our gateway to our body. Yeah, that's the first thing. Everything you eat comes through the mouth as it gets into our bodies. Yeah.
All right. And actually, when you talk about confidence, I understand, especially for the ladies, we actually get to take care of ourselves, especially when it comes to, you know, smiling. Because some say, you know, when a guy sees you smiling like that, and they'll be, oh, she has a very
self-esteem.
Yes, even the self-esteem.
You just do like this. Yeah.
All right. And of course, as we delve into this conversation, maybe you can tell us what causes poor oral health.
Yeah, let's first say the first thing is poor oral hygiene. That's the main thing to most people. How are you taking care of your oral health? Having a poor oral hygiene. Yeah, like now we are talking about how to take care of our teeth. That is good oral health. Like here I have a dental floss. This is the dental floss. You should have it. Everyone should have a dental, but many people assume only the toothbrush and the toothpaste. I'm done. That's the normal people, they do it. We have a toothbrush here, a Colgate, and also Sensodyne, and also a mouthwash. That is how to maintain good oral hygiene. So another thing that causes is smoking. Many people smoke. That will also cause poor oral hygiene, will cause gum disease. Another thing is alcohol intake. It lowers your saliva, causing poor oral health. Also diseases like diabetes. If you are diabetic, we could advise you do your dental checkup every 6 months, because diabetes predisposes you to gum disease. Also, there are people on medication like antidepressants, antihistamines. Also, those ones, they lower your saliva in the mouth, causing poor oral health. Yeah. Another thing is some people are not able to access dental care, like in the rural areas. Those people, if they don't get the dental services, you know, dental care is also expensive. Like in the middle countries like Kenya, many people are not able to afford dental care. Like you tell them you come for a checkup. Dental checkup is 500. Oh, doc, I cannot afford. So that's why, like me, I have a foundation, Better Smiles Foundation, where I want to start enriching people about dental care, doing free checkups in the community. Yeah. Yeah.
All right. Wow. And you know, the funniest thing about this conversation is that, you know, oral health affects every one of us, because you need to smile and you need to keep your breath fresh, and you know, just having that shining bright of your smile, and even when people see you from afar, they can tell, oh, you know, they did brush their teeth. And actually, as you talked about, just to go back on the confidence part of it, when you speak to a person, and some of the people tend to concentrate on your face, that is on your mouth, how you're speaking, and when a person, actually, you've ever gone to an event and then you eat some sukuma and one sticks in your mouth, and so when you go to smile and speak, when someone tells you, oh, you have something in your, oh my, so maybe starting from that point, you feel like your confidence is lowered, you feel shy about it. So it's very important. We can even tell people on how, like, after you have taken your meal, and that's what you mentioned about the dental floss, you can definitely, you know, remove those particles in your tooth. Let's talk about the basics of making sure that you take care of your oral health and have like a good oral hygiene. What are some of the tools and the things that you need to have in your house as a lady and as a gent? Okay,
some of the things that you should have is, we talked about the dental floss. It's not expensive. It's about 65 shillings in the supermarket. They are all over in Kenya. So this is the dental floss for removing the food particles in between your teeth. You know, sometimes, like you have talked about the skuma, you eat, they are stuck. Then some of you use toothpick to remove. But most of the time, when maybe you are at work and you eat, and maybe you didn't carry your dental floss, go take some water, just rinse and your gargle, rinse with water. And if possible, if you are carried your brush, you can also brush at work. Then we have the toothbrush. This is the toothbrush. That one is very important. You change your toothbrush every 3 months.
Okay.
Some of you stay with your toothbrush, mpaka hizi the bristles, they are worn out. Mpaka tu ukiangalia hivi, ndio unakumbuka, I need to change your brush. So that one also is very important. After every 3 months, let's say 3 months, you change your brush. And also the kind of brush you are going to buy. Not all brush at ukikuta mswaki unanunua. No, you check either the medium size or the soft bristled toothbrush, so that you will not affect your gum when brushing, because when you do that, you get what we call gum recession. So gum recession is like, you see, like in this nini, the gum should be, this is the gum line. So when you do aggressive brushing and also hand toothbrush, you affect your gum line, causing gum recession, then tooth sensitivity. You know, now we are going to, you get tooth sensitivity. Then you go to the doctor, oh, my teeth are sensitive. You get, no, so the kind of toothbrush you are using, and the one you buy from the supermarket or chemist, wherever.
Okay, and still on that part of the toothbrush, there's some people that say you're supposed to have 2 toothbrush. There is one for the morning and one for the evening. As a community oral health officer, do you advise that, or maybe that one doesn't even vary so much?
No, that one doesn't vary. The only thing is change your brush after every 3 months. And you ensure that you brush your teeth at least twice a day. That is in the morning and in the evening before you go to bed. So on that, before you go to bed, some ask me, Doc, why do I have to brush before I go to bed? See, already I brushed in the morning. So the reason why we advise brushing twice a day, like the whole day, let's say you brushed in the morning, you went to work, you ate chips, everything. Then in the evening, let's say your dinner is chapati, and you take juice. See, some people also take juice before they go to bed.
Yes.
So there the chapati has starch, the soda ama the juice, hapo sikuna sugar.
Yeah.
So the moment you are not going to brush before going to bed, in your mouth you have the normal flora, the normal bacteria. Then you fail to brush your teeth before going to bed. The bacteria will feed on the starch and the sugar in your mouth. They go through the process of fermentation, they form acids, then they corrode your enamel, that is the mineralization of your enamel, causing tooth cavities. You get why we advise brushing at least twice a day before going to bed. Then you get cavities. Now when you get cavities, you come for tooth fillings. Maybe you fail to come for tooth filling, the tooth starts paining. When it's too late now, you have to do root canal. Now we come to where we are saying that oral health care is expensive. Because when you come, my tooth is aching, and many people come when the tooth is aching. I say, we need a root canal. How much is a root canal? Maybe I say 12,000 or 15,000. That is very expensive. And when you do the root canal, you also need a tooth crown. They say 25,000. That is approximately a cost of 40,000, which many people will not afford. So that's why I'm saying brush your teeth at least twice a day. So when you brush before going to bed, there is no wound that the bacteria will feed on, no formation of cavities. Yeah. You get?
Yeah, I get it. And of course, again on that, some people say, and some doctors advise people to brush their teeth using lukewarm water. But sometimes people use cold water. On the toothbrush bit of it, whether you want to have your toothbrush for the morning and for the evening, that's your preference. You can also do that as well. But what about when it comes to using water?
I think on the water, it's a matter of choice. Or maybe you have sensitive teeth. Maybe you prefer to use the lukewarm water because your teeth are sensitive. Yeah. Yeah.
So that
It's
doesn't
about
vary.
Yeah.
Okay.
It doesn't. Yeah.
Because some say if you use cold water, it may affect your gums. Some say when you use lukewarm water, or even it may help to kill those germs.
No, I think what they talk about is the warm salt water. Maybe after brushing, you can use the warm salt water to gargle. Yeah.
Okay. All right. Awesome. That is well clear. And of course, we shall talk about on the layers of your mouth and how the steps on how you're supposed to brush your teeth. Because some start with their tongue, others end with their teeth, others start with their teeth, and then they end with their tongue and their lips. And even some, they don't even brush their lips. We'll talk about that. Why is it important to brush your lips as well? Maybe you can talk about the effects of not maintaining a good oral hygiene. What are some of the effects?
So when you not maintain your oral hygiene, let's say bad breath. We start with that one. Halitosis, that is, we call it halitosis. Ukifika kwa hata ama kazini ukiongea, you hear them saying, I need a chewing gum all the time because you want to maintain the fresh breath. You get, that is one thing. You get bad breath, which is most common to people. Many people come complaining, I have a bad breath, but also the bad breath can be caused by other factors. Maybe you take a lot of spicy foods, maybe tonsils, acid reflux. Also that one can cause bad breath. You get teeth decay, that is cavities. We talked about that, not brushing. That is another thing. If you don't keep good oral hygiene, you get cavities, you need tooth filling, root canal, and if you fail to do a root canal, tooth extraction, You know, now you might get old. Kila saa unangolewa. Because it is expensive. Ukikuja sasa, I tell you root canal, a doc, extract. You extract, you know now, the impact goes down. You extract, teeth replacement is also expensive.
True.
Yeah. Another problem is oral diseases, like cancer. If you don't keep good oral hygiene, like cancers, those oral diseases, cancer, they are contributing like smoking, tobacco use, those ones. Those people who smoke, you get that they will have oral cancers. That's another thing is breathing gums. Many people complain of breathing gums. If you don't keep your oral hygiene, you have breathing gums because of dental plaque build-up. The uchafu, na kitanda nakanganga, there is something on my tongue, which I try to brush, but it doesn't come out. That is the dental plaque. Because of poor oral hygiene, it goes to breathing gums, gingivitis, periodontal disease. So it comes down, affecting the bones you get. Then you end up mobile teeth. You see, you fail to brush, you get dental plaque, that is the calculus. Maybe you fail to come for checkup, dental cleaning. You know the dental cleaning. You have heard about it. Teeth cleaning. They call it kusafishwa meno. That one. You fail to come for teeth cleaning. You people say, nikioshwa meno zitakuwa sensitive. They fail to come. It goes down to severe gingivitis, chronic gingivitis, periodontal disease. It affects the periodontium, the bones. Now you end up to mobile teeth. When you get mobile teeth, we end up extracting your teeth, dentures. Yeah, those things.
Okay. All right. Thank you so much, Rose, for that introduction bit of it. And I think we can get a little bit of demonstration explaining to us on the layers that we have, that is, so that we can have some time. We go for the break, and then later when we come back, we shall continue the conversation talking on how maybe if you want to go for a dental clinic, how often are you supposed to go and wash your mouth? I mean, to get those kusafishwa meno, as you mentioned about it.
Yeah, they say that kusafishwa meno.
Kusafishwa meno. Yeah, and maybe, of course, for the checkup bit of it, and you can also talk about St. Mary's Mission Hospital. If one would love to come in for the dental checkup, when can they come and from what time to what time? But right now, kindly take us through on the layers, because I can see you have a prop there with you, and tell us now the steps on how we are supposed to brush our teeth.
Okay.
Yes.
So on the teeth, so this is an healthy tooth. You see that one? There is no cavity. The tooth is very healthy. We have a sensitive tooth there. This one. We have a decayed tooth. This is the decay. You can see there is also the abscess. So we start with the healthy tooth. We have the enamel. The second layer is the dentine. We have the pulp chamber. Down here we have the roots. You get? So this is a healthy tooth. This is where somebody has good oral hygiene. There is no pain. Your teeth are just okay. But don't assume that your teeth are okay. You come for checkup in the clinic so that we can check. So now we have sensitive tooth. Here we have maybe a small cavity. Then you feel that my tooth is sensitive. But at this stage, many people don't come for checkup. Unatumia, wengine wanatumia, ananunua tu the Sensodyne. This is the Sensodyne. They use, it comes not often, it comes and goes away. So you are okay. You not come for checkup. The cavity goes down to the pulp chamber. You see this one? This is the pulp. If you fail to come for tooth filling, the cavity goes down to the pulp chamber. This is where most people come for. The tooth now is painful. You cannot even sleep. You are calling, daktari, utakufika clinic sangapi, so that I can come, my tooth is aching. Now even the painkillers are not doing anything, especially at night. You have a tooth decay on the pulp. Here we call it, now you have pulpitis. We do a root canal. Yeah.
Okay.
You have one of the root canal.
Yes, we are.
Yeah.
That's
so
what I
the
know.
cavity is on the pulp chamber, on the nerves.
Okay,
Yeah.
all right. And now talking of the brushing, kindly tell us, how are you supposed to brush your teeth? You have your water with you, whether it's cold, whether it's warm. Which parts do you start? We know we have the floor and we have the rooftop,
The
roof, the palette, all of them. Kindly tell us and show us. Maybe some of us have been doing it wrong. Tell us more about that, even when you're brushing your tongue, Pierre.
So before you, in your house, as you said, as a reader, as a man, there are things that you should have: the toothbrush, the dental floss, the toothpaste. Now specifically, the toothpaste would be fluoride toothpaste. There should be a fluoride content in the toothpaste, and also the mouthwash. Sometimes you can have your mouthwash in the house to keep your oral hygiene. So this is just a demonstration of how you should brush. After you have all these requirements, there are some people who brush. So I can open this.
Yes, you can definitely do that, and make sure that our viewers get a very good demonstration on how you're supposed to brush your teeth. That is a step by step. Once you buy your toothbrush, you have to unwrap it and make sure you remove it from that.
So this is the toothbrush, and here we send soft bristles, these ones, so that they will not injure your gums. So when you are brushing your teeth, you should not do back and forth strokes like this. So many people do hivi. Si ndio? So many wanafanya tu hivi, and they say, nimemaliza. Then they come here, they do like this. I'm done. They rinse, then they go. No, that's not the right way to brush your teeth. You should brush in a circular motion. Like this, you get circular, not back and forth. It will cause gum recessions. We talked about gum recession, which will cause sensitivity in a circular motion. Pole pole too. And brushing time is 2 minutes. Take your time. Don't rush. So that's why we are saying brush twice a day. Because sometimes in the morning, unakimbia tu kazi, unafanya tu hivi juu, unaangalia time, unachelewa kwenda kazi. But before you go to bed, you have all the time. So you brush in a circular motion and you concentrate all areas. You have the buccal surface. This is the buccal side here. You go inside the ring wall and the tongue. Then occlusal surface. Okay. You also brush there. Some people don't brush. Ndani. They are done. So in a circular motion there, you also come inside occlusal surfaces. You go up also occlusal buccal na bado huku ndani pia. Then also you can also brush up and down. Like interproximal. You know, like sometimes you brush this way in a circular motion, you not get the huku katikati. So you come up and down. Then after that, after brushing, you rinse. Then you take your brush again. Maybe if you have used the fluoride toothpaste, some people ask me, Doc, do I need to rinse my mouth after using the toothpaste? What do you say?
Of course you have to.
No.
You don't
fluoride is very important in our teeth.
You just leave it like that?
You can first brush. We always say about we save the toothpaste. Ndio tusinunue tena. Hapana, this thing is not even expensive. Sindio? It's like 100 or something. So me, I would recommend you first brush. You rinse. Then you take the toothpaste kidogo tu, pea-sized toothpaste kadogo, sieke mingi. Then you brush again. Then you spit the toothpaste to remain, so that it can help in mineralization of the enamel. You know, we talked about this one, the enamel,
we did.
the outer part of the tooth, so that it can become stronger. So if this enamel becomes weak, you get more cavities. So the fluoride toothpaste, it has fluoride so that it can help in mineralization of the enamel, so that the tooth can become strong. So but most people rinse. Hiyo ijaingia sana kwa watu.
Yeah.
Watu wana brush tu wana rinse. Maybe you can start maybe brushing, you rinse. Kutoa the uchafu.
Okay.
Then uweke kadogo tu. Unini umbrush, uspit ikae hapo. Ndio meno zikae strong. Na pia on the to make the teeth strong, drink milk, eat vegetables. You know, the milk has calcium. It will make your teeth stronger. Yeah.
We'll definitely talk more about on the diet bit of it after the break. And I know you've not touched on the brushing of the lips, how you're supposed to do it, and of course maybe the tongue. I think we shall take a very short break, but when we come back we shall continue with the demonstration bit of it. And thank you very much for showing us on how we're supposed to do and to take care of our oral hygiene by brushing our teeth. And of course this conversation is not yet done. Actually we're getting started, because we haven't even talked about the diet, bringing on the ice cream bit of it, because some people snacks as well, and
children
even
should
biscuits.
Brush
Even
the kids.
Perfectly, and even all the grandmothers and our grandfathers. And while we shall take a very short break on our Health Corner show right here, stay tuned on our second part. Don't go far. We shall have more to tell you and to inform to you about on how you're supposed to take care of your dental and oral hygiene. Stay tuned for that. And in case you have any question, please do reach out to us and give us on other bits that you do to make sure that you take care of your oral hygiene and how you go about it. We will be reading that in our second part, and tell us where you are tuning us from and following this conversation from. Stay tuned for that and don't go far.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. Feeling unwell, seeking expert medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic health care. Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning, and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital, Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, MCH and maternity, ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cash.
Specialist clinics and CT scan services, Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 0797 972 794 or 0769 781 880 or 0717 305 204 or email us at info@stmarysmissionhospital.co.ke. St. Mary's Mission Hospital, Langata. Compassionate in healthcare. Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
Hello, dear viewer, and welcome back to our Health Corner show right here on Capuchin TV with me, Maureen Kimani, for our second part. And in the studio, I'm being joined by a guest from St. Mary's Mission Hospital, that is Rose Kenya, who is a community oral health officer. And in case you are joining us right now, in our first part, we've been able to discuss and to talk more of how to take care of our oral hygiene and our dental care. And in this second part, we shall continue with this discussion even in terms of how you're supposed to take care of your diet when it comes to tooth and teeth related oral health and dental care as well. And of course, in case you have any question, please do reach out to us as we continue with our discussion and unpacking these conversation and topic that affects all of us, because we all said that in our first part that we all smile and we all have our tooth, so we all need to take care of our oral hygiene and our teeth. Yes, welcome back, Rose, for a second part. And before we had gone for the break, I remember you were doing the demonstration on how you're supposed to brush your teeth. And there were some bits that you didn't touch about on how to brush your tongue and, of course, your lips. Is it even necessary? Because some people, I'm sure they're very shocked. Why should you even brush your teeth? I mean, your lips. Please tell us more about that.
Yeah, you should brush also your lips and also your tongue. Many people tend to omit their tongue. So after you finish brushing all your teeth, all the surfaces, then you come to your teeth, your tongue, up and down, up and down. Also you can brush your lip also to avoid things like mouth sores, those ones. Yeah. Yeah. Okay.
And afterwards you brush your lips. And there's some people who say if you don't want to use your toothbrush because they feel lips are very sensitive and you don't want to maybe hurt them, so you use maybe a kitamba to just maybe rub and
I think that one is a preference. Yeah.
So you can
but even
use
the tongue, there is the tongue scraper. You can buy them from the supermarket. Instead of using the toothbrush in your tongue, you can go buy the tongue scraper to brush your tongue. I think that one is more effective than the toothbrush in your tongue. Yeah.
And how far should you go when you're brushing your tongue? Because sometimes you find when you're brushing your tongue, you feel like you want to vomit. Is it because you've reached, maybe you've gone to the farthest, or or is it normal? Is it okay?
Normal to many people. I think you get used. But many toothpastes, even me, I used to brush my tongue. You feel like kupuke that one. That one ni kuzoea tu. Then you get used, ama you brush slowly. That's why I'm preferring the tongue scrubber. I think that one is better than the brush itself. Because the brush, you feel like
you want to vomit.
Many people don't buy the tongue scrubber. They use the toothbrush. I would advise the tongue scrubber. Yeah.
Okay.
Yeah.
And is it okay for one to maybe brush even twice in the morning and then in the evening? That is at first you brush and rinse your mouth, and then later you just put a very small bit of the toothpaste and then you brush again. Is it okay, or is it too much?
I think it's fine, but don't overuse. Yeah. Brush just twice a day, at least twice a day. And if you are even at home, you are free, brush even thrice. Yeah, but not aggressive brushing. Soft.
Gentle.
Soft.
You have to be very gentle.
Yeah.
Okay, because some of us, like, I feel when we wash our mouth twice, that's when you feel it's clean.
Yeah. Like in Nairobi, I don't know if it's because of water, what's the issue. You brush, you feel, it's not enough.
Yes.
But when you come to that point, you come for a dental checkup. There might be calculus. The dental break we are talking about. Unafeel kuna vitu zime stick kwa meno yako. Because the time you brush, you do like with your tongue like this, you feel that your mouth is, the teeth are soft. But the moment you brush and you feel, no, that's not enough, it's an alarm. Go for a dental checkup. We see, is there any calculus? Do you need teeth cleaning? Yeah.
Okay.
Maybe you have stayed for long, like 3 years. Hata hujai kuja kwa meno, hata hujai kuosha meno. Na the more unasugua sana, the more we have talked about the gum recession. The more you affect your gum. I think it's an alarm. You go for a checkup. We see what's happening.
Okay.
Why after brushing, you feel like brushing more.
All right.
Yeah.
And I can see you also have a mouthwash. Maybe you can tell us, is it okay if you just use your mouthwash and you don't use your toothpaste that you mentioned? It is very important to have the fluoride one. And we also have different types of toothpaste. There are some which are herbal toothpaste. So maybe you can tell us more and the difference between the mouthwash and the toothpaste and the herbal ones.
Okay. On about brushing on the toothpaste, the thing that I've noticed, many people, they use the Sensodyne toothpaste. They don't use the fluoride toothpaste. I think the Sensodyne toothpaste is only for sensitivity. Those people who have sensitive teeth. So normal brushing start with fluoride toothpaste. And I've talked about when you go to buy your toothpaste, it doesn't matter which toothpaste, Colgate, whatever, Pepsodent, all those kind of toothpaste, but you check the content. Is it a fluoride toothpaste? Because the fluoride will help in making your teeth stronger, the enamel, which will not predispose you to cavities. So after brushing, if you have sensitive tooth because of gum recession, then it's when you use the Sensodyne specifically. Some people use it as normal routine, and we have different types of Sensodyne. There is the daily use Sensodyne, there is 2-week Sensodyne, and duration of only 2 weeks. There is the 1 month Sensodyne. So that one is after prescription by the dentist or her oral health officer.
Okay.
Then on the mouthwash, not daily use. It should, because sometimes some mouthwashes stain our teeth. You see that my teeth, after using the mouthwash, they have turned brown. I would prefer mouthwash to be used on daily use. So it's after prescription by a dentist, maybe after dental cleaning, teeth cleaning, kusafishwa meno. Yenye tulisema ni hearing. After every year, you do teeth cleaning, unless those people who have other medical conditions like diabetes, those ones you need to do dental checkup every 6 months. 6 months. Yeah.
And then I'm very curious to know, because nowadays it's very common to see people who have braces. What about for those viewers, maybe they might be following us and they have braces and they don't know how to go about it? Is it the same case when we brush our teeth and for those ones who have braces, or there's a difference on how they're supposed to brush theirs? Because I know sometimes you may find, there was a time, I don't know if they still exist, there were some braces that you can be able to remove and wash them and then you put them back. But nowadays you may find like it's actually there you have to go to the hospital to get some cleaning. How do you go about that?
On the braces, I think they need the soft brush, because most of them, they'll come out. The soft brush, softly, brushing softly. Yeah, then they, you know, braces, you have a follow-up every month, talking to your dentist,
And of course, even the type of food matters a lot. They don't take harder foods. Yes, okay. All right, let's talk about on the diet bit of it that you were able to touch before we went for the break. And we also mentioned about ice cream, eating too much ice cream. Some people, when they take cold foods or even drinks, they feel as if you have sensitivity. Does it mean you should go for a checkup?
Yeah, very important.
Or is it because you're taking too much cold things like ice cream and biting, so it has some effects to your tooth?
So when you get teeth sensitivity, it means there is something going on. Maybe you have teeth cavities, which means tooth filling, or also you have gum recession. Yeah, most of the time. Yeah.
Okay, and we haven't talked about babies.
Yeah.
You know, homes, we have some nephews, there's some mothers who have their kids, and you find there's some small toothbrushes for the babies. How old are you supposed to start brushing your child?
As soon as the first tooth erupts.
Yeah. That's when you're supposed to start. Because you find they're taking milk, and then if you take a look on their tongue, it's purely white because of that creamy of the milk. Yeah. So as soon as the
first tooth erupts, and some, you may be the kids, you are not able to brush because they cannot spit the toothpaste.
Yes.
And about the kids, they are children toothpaste. Many people use the normal toothpaste. You go to the supermarket, you get the kids toothpaste from 3 years to 6 years, 0 to 3 years, 3 years to 6, 6 years to 8. The toothpaste are there in the shape, and even they are not expensive. 160 shillings is affordable, because when you use this toothpaste, the permanent, when they are coming in, they will be brown or chalky white. Yeah, I think it happens in many kids. Yeah, the type of toothpaste you are using on the kid also matters. And the small babies, maybe 2 years, if they are not able to spit the toothpaste, as a mom, you can have a clean cloth. Then you wipe. You wipe a clean cloth, then you wipe their gums. Many people don't even brush the kids. I don't know why. Because they don't know how to gargle. Yeah, they should use the normal kids toothpaste. And those who can't spit, unatumia ka clean cloth, then you wipe their gums. Yeah.
Okay. And what about for those people who have maybe filled their tooth, and sometimes they remove them, they dip them in a small like tin, and then in the morning they put them back. Are you supposed to remove? Because I've ever had a case someone swallowed the tooth. Maybe you can explain that.
Yeah, that's now if you have poor oral hygiene, we end up to tooth rows, that is tooth extraction. Now we do that we call them dentures. Hizo meno za wanasema ni meno za kuweka hivyo ndivyo wanasema, the dentures. We recommend you remove them at night so that your gums can rest. You get so that the gums can rest. You keep them in a container of cold water. Then in the morning you brush your teeth. You brush also that cadenture, then you sit it. Because if you fail to kutoa the cadenture, you know, hapo esengine inaekwa na iko na caprate huko juu. So the food will pack there, and the brush cannot reach there. So you just remove them at night. You keep in cold water, a container, clean container, cold water. In the morning, brush your gums, your teeth well. Then you take the cadenture, brush it well, rinse, then you sit it. So at night, we recommend removing them so that your gums can rest. Yeah.
Okay, and just to read some of the reactions that you're getting, we have Sigay Elvis who is saying, Health Corner Show is very informative. Today I am shocked that I've been brushing my teeth wrong. He's thinking of, biting the nails. Actually, some of the people use their nails to remove those particles, the food particles in your tooth. How... and it's very unhygienic because how do you just...
You introduce bacteria.
Yes.
Yeah.
Let's talk about that effect on the bacteria bit of it. I don't know if so many people know about oral hygiene when it comes to putting on your nails and removing those food particles in your mouth, because sometimes you find you've greeted so many people on the road. You've touched maybe so many items as you continue with your daily activities, and then when you take a food and you put it, and then maybe it gets stuck, especially on the meat, watu wanapenda nyama choma pale, and then you put your, your finger and your nails by removing. What kind of effect does it have?
Yeah, so the time you touch, maybe I've touched this thing is not clean. Now I'm trying to remove kachakura like I'm doing now.
In a natural way.
So one thing, you may injure your gum. Upate kakidonda pale na katasumbua tu. Another thing, you introduce, the mouth has the normal flora. You introduce another bacteria in your mouth. Also it will cause gum disease, mouth sores, those bacteria. And also people use toothpick. Kuriko wanunue the floss, they use the, wakikosa kutumia the kucha, the toothpick. But it injures the gums in a create pockets. How we really define that one? Pockets, spaces. Isema hii ni meno hapa, ukitumia the toothpick, unajua una create kashimo. Hapo mahali unaingiza the toothpick. Ina create shimo hapo. The time you eat food, ina crotch hapo. Na brushing, una brush hivi. Na wengi hawatumii the dental floss. So that food yenye ilipack kwa hiyo pocket, itatoka. Sita cause bacteria, eventually gum disease, bleeding. Then you come for checkup. Doc, my gums are bleeding. You see how it happens. So having a dental floss, this even is not even expensive.
Goes for 100 bob.
Even this one I bought
50.
at 65.
65, depends on where you buy it.
Now you can use one, like maybe 2 days.
You clean it.
It's it's affordable. Something affordable. Also, there is something we call the interdental brush. I didn't come with it. Now, this is the normal brush. We have 2 types of brush, the normal brush and also the electric. There are also people prefer, you have heard of electric brush. There's also the electric brush. It's better than the manual. And also the interdental brush. Now, like that one he is talking about, food imekwama hapo sasa kutoa hiyo floss na interdental brush. I think even the interdental brush even is not expensive. I think 600, 500. So you have 2 brushes. This one, the interdental brush or my electric brush. After now you brush, kama uko na uvivu kutumia the floss, you have the electric, the interdental brush. They are there. But people don't know about the interdental brush. So the normal brush, see, we have said you brush in a circular motion, up and down also, but now in between the teeth, these spaces, the interproximal spaces, the food zimepakuku. Hii brush iwezi toa. The electric can remove a bit, but not all. Food itakwama huku, so ndio na advise the interdental brush. Even it's better than the dental floss. Sasa hako ka interdental kanaingia. I wish I came with it. Inaingia katikati. Unaona? Inatoa sasa uchafu.
Okay.
So my best advice, normal brush, interdental brush.
Okay.
Sasa alafu ka frost, maybe umekura job hiyo, sasa sukuma imeingia, unatoa nayo. I think that one is better.
Okay, thank you so much. It has been a very enlightening conversation, and I'm sure our viewers have been able to learn a few things here and there. And I understand our time is up. Just to give you like 1 minute, Rose, as we wrap up with our discussion here, you can talk about on if someone would come to visit St. Mary's Mission Hospital, how can maybe what time can they get in the hospital to come and make a visit for the dental checkup, and of course the time. You can also lay out information, and we shall be getting other information on the different activities of the St. Mary's Mission Hospital, the medical camps that we have. And we can see we have the interdental, here we have it. Very beautiful image, so maybe you can go and check on where you can buy that and have it in your pocket and in the tools of your oral health hygiene care. All right, Rosa, your time.
Okay. In St. Mary's Mission Hospital, we have a dental spa. Let me call it a dental spa. We restore your smile, very beautiful. So we run from Monday to Saturday. Yeah, from 8 a.m. to 5 p.m. On Saturdays from 9 a.m. up to 1 p.m. In our clinic, we have doctors. We have a dentist, that is a dental surgeon, a full-time dental surgeon. We also have a maxillofacial surgeon. So our dentist is a full-time doctor. She is on from Monday to Saturday. And also we have our maxillofacial surgeon. Those oral maxillofacial cases which needs review, you can come to our hospital at St. Mary's on Wednesdays. That is when we have our maxillofacial clinic. We do all services from dental consultation. You just come for dental consultation. It's not a must you come to the clinic ati mpaka ile siku umeumwa na meno. You know, that is what people do. Mpaka ile siku nimelala nikikunywa painkiller ndio nitafika St. Mary Dental Clinic. No, you come for just a dental checkup, which is 500. Those people who have insurances, we also take insurances. We do a dental checkup, we give you a plan. We have also talked about teeth cleaning every year. You come for teeth cleaning. We do tooth extraction, braces, permanent teeth replacement, that is crown and bridge, dental implants, child care.
All right.
We have a pediatric dental clinic opening soon. Yeah, so those kids, wale watoto wadogo sasa wenye tuko tunaongelea, watoto,
the parents can
care.
come.
How do we care for our kids' teeth? We have a pediatric clinic opening soon. Unajua watoto wakikuja clinic wanalia sana, hawataki kuhudumiwa meno. We got you. Those small kids, 2 years, 3 years, bring them for a checkup, 4 years, maybe up to 5 years. We have a clinic for them. Yeah.
All right. Thank you very much, Rose, for making time and for sharing those valuable insights and beautiful comments on how we are supposed to keep our oral health hygiene. And I'm sure our viewers have been able to grasp some few things when it comes to brushing your teeth. And make sure from today, don't do it the wrong way. We have been able to get some demonstrations. So please make sure that you do all the steps that have been shown here to make sure that you have a good oral hygiene and continue keeping your bright smile. And you can also keep in touch with St. Mary's Mission Hospital for more health checkups. And just to mention, as we went up, there will be an upcoming medical surgical camp at St. Mary's Mission Hospital. That is date 9th and 10th April 2025 from 8 a.m. to 3 p.m. So you can get in touch with the management and follow up on the St. Mary's Mission Hospital number. And of course, a free orthopedic camp on date 9th and 10th, that is on the same day, from 8 to 3 p.m. You can get your bow legs checked, implant removal, chronic back pain checkup. So at Capuchin TV, we'll be able to put that on our Facebook pages. You can definitely get to follow up on that. And as we wind up, thank you very much for tuning into our conversation, and thank you very much, Rose, for making time to share those beautiful and enlightening discussion and comments on our oral health. And remember, good oral health is good overall health, so keep that in mind. And just saying, I can see we have Irene, who is following us all the way from Mombasa, anasema Jenta says hi Jenta. And she says a very good conversation there, Maureen and Rose. Thank you very much to also Kevin. I can see you are sending in your comment on how you've been enlightened on a conversation. I'm wishing you a very good day, and take care of your oral health and hygiene to make sure that you smile all the way and every time. Have a good day. My name is Maureen Kimani, and our guest has been a Rose from St. Mary's Mission Hospital. God bless. See you next time.
Oh.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. Feeling unwell? Seeking expert medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic health care. Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning, and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital, Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, MCH and maternity, ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cash.
Specialist clinics and CT scan services. Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 0797 972 794 or 0769 781 880 or 0717 305 204 or email us at Info at stmarysmissionhospital.co.ke. St. Mary's Mission Hospital, Langata. Compassionate in healthcare.